In a speech today, Keir Starmer is laying out the government's plan to slash the NHS waiting list. Labour wants an extra 450,000 patients to be treated within 18 weeks of a referral by next year, with 9 out of 10 patients being seen within that timeframe by the end of this Parliament. Yesterday, the Health Secretary Wes Streeting warned that the health service could go extinct without major changes. Here he is speaking to Trevor Phillips on Sky News.
When the Prime Minister sets out the plan, you will see a wide range of reform we're putting in place to modernise the NHS, to give it the tools to do the job, to bring it into the 21st century so the NHS doesn't go the way of Woolies and collapse, but is actually a service fit for the 21st century. And I do think it is that existential for the NHS, which is why both in opposition and now in government have placed such heavy emphasis on reform, not just investment.
So what are Labour's plans? Here's our hospital frontage for you. Let's go through them one at a time. Firstly, tests, scans. So centres for tests and scans in the community opening for 12 hours a day, 7 days a week. Secondly, choice, more choice. GPs giving patients a choice of up to 5 hospitals when referring them. The next one is an app, and this is about more users of the NHS app being able to view and manage their appointments. In the next window, GPs. GPs getting £20 per patient to consult a specialist via phone to see if they could do something for the patient without sending them to hospital. Then this one says routine, because they're going to axe a lot of routine checkups. And the last one here, let's have a look, says scans. So this is doing scans without consultants, which is much easier. GPs sending people with conditions like ear, nose and throat problems, breathlessness, even gynecological issues for tests and scans without a consultant being on board. There are the 6 in the front of the hospital. There it is. What do you think, James?
Look, I'm with everyone else. You know, I wish the NHS was run properly. I wish it was successful. You know, I'm a bit of a socialist at heart. I think everyone should have access to decent healthcare, and unfortunately, that's not the case. Look, I really like Wes Streeting. I think I should say that. I think we're all fans of him. He seems like an honest guy. He seems like he really cares. And I think we all really want Labour to succeed. I want anyone to succeed. I don't really care who's in government if the NHS is working as it should. My problem is that a lot of these ideas, things like an app, I mean, that's great on paper. But the reality is that I think for me, the best way to start fixing the NHS is to look at the wider issues in our society and the fact that people are very, very unhealthy. You know, we've got job crisis, we've got housing crisis. We need to start investing in our communities health-wise. And then on the back of that, hopefully that will free up a bit of time, because an app's not going to create new beds. An app's not going to employ new surgeons.
Well, yeah, you saying that just strikes me that the biggest single thing is that if you go into a hospital now, it is full of old people who haven't got a home they can safely go to. They can't go back to their own home and they can't go into a care home. That is called a social care issue. And they've just announced they're going to spend 3 more years thinking about that. What do you think of this?
I think in terms of the £20 bonus, if they can refer patients to alternative, treatments or specialists other than hospitals, it needs to be done on results only. Because what you'll find is doctors will just keep on referring to get that money, and they may have to go to the hospitals anyway. So then what
are
would
they
be
that
the point
twisted, the doctors? I mean, they surely going to do the best for their patient,
the reality
aren't they?
is, I wouldn't say they are intentionally horrible or ill, their intention is bad. But we're dealing with overworked individuals, we're dealing with too many people being seen, and if the quickest way to just tick a box, I referred them to an alternative other than the hospital, I don't want our taxes to just be hemorrhaging towards £20. How many doctors? If they refer 5 people to 10 people a day, £20 a pop, GPs across the country, that's a lot of money. I think also you made a good point. There's a lot of elderly people in the hospitals. We've got an ageing population, and now we're trying to push them onto apps. It's not realistic, and it's unfair.
That's a good point. So maybe the NHS is unfixable. Maybe, and Wes Streeting said this, it might go the same way as Woolies. Virginia in Somerset, do you think Labour have got the tonic here?
No, definitely not.
Well, what does it need?
What it needs is to go back to grassroots. They waste too much money, for one thing, and they need to concentrate on what's broken. They're not. It's all about patient. They keep saying, "Oh, we'll get you to see somebody. You'll get more patients through the door." That's not true. That's not going to happen, because you can't even see your GP to get someone to look at it before you get sent to the hospital.
No, I know.
The lady just speaking, she's exactly hit the nail right on the head. Oh, they can't be bothered, so we'll send you to see somebody. Now, that's not right. You're just going in and out of hospital.
Well, then maybe the solution is, in that case, we're sunk, can't we? Because we've got 69 million people. Most of us are unhealthy in some way, and the NHS can't. It's not big enough to deal with us. That's fundamentally it. So what do we do?
It wasn't designed for that. When it came out, it was to help people who had no money to see a doctor. I can remember lying in bed when my mother paid Dr. Sinclair 2 and 6.
Well, that must have been, what, 1950 or something?
Oh, God, before that, just a bit before that.
How interesting. Because that's,
I was born in
of course,
1946, and I was quite poorly when I was a child.
Yeah.
And I can remember the doctor coming, Mum had to give him 2 and 6. I know it was true.
2 and 6.
It was after the war. I mean, the bottom line is all the money they waste. I went to hospital, walking down through A&E. There was 3 beds, a big, huge beds that we, Western Square, paid for. And on the placard on them was broken. Porter, please remove. Broken. 3 of them. Now, if they had a good mechanical engineer there, who they should have working in a hospital, obviously, maintenance men, out of 3, they could probably repair those and make 1.
Yeah, for sure.
Thrown in a skip.
Thank you, Virginia. And what can I ask what age you are? Because you sound great, whatever age you are.
79.
79. You've got a lot of life there. Wow. Stay well.
I don't know for how much longer, because I've got a thing on my leg, and they told me a year ago it was nothing. Last week I got told it was a cancer.
Oh, classic, isn't it?
Lucky for me, God rest. I am not. It's not serious.
And it hasn't spread. It was a melanoma, is it?
No, it's a Bowen's one. But even saying that, they should have seen it when I went 23rd of March last year.
Of course.
They gave me a prescription for cream.
Cream.
Without seeing a GP, that was a nurse.
All right. Well, thank you. I wish you all the best. 79. I think she's going to get to 95. I would predict.
She certainly sounds like it.
Sounds
lively.
Forthright. Yeah. Woof. Shelley in Newcastle. Hi. Hi, Shelley. No. I feel like we're going to. No, nothing. Not even a sound of a phone line. Like the volume's not up or something. Oh. Bridget in Northamptonshire. Hi.
Hi.
Hey, so I'm well, thanks. And I'm looking at these. I mean, I don't know what the NHS needs, let alone whether this is enough. What do you think?
Well, I'm disgusted this week. As I was just telling quickly, I've had violent earache. I ring the doctor, I'm number 25. I go to the doctor, they're full. I go to 2 chemists, they can't see me. I go to 8 till 8, and they say, there's nothing we can do. You've got a glue ear, and if you're a child, we could deal with you, but there's nothing we can do. I've still got earache. That's terrible.
So I know earache is a bad one. Yeah, it's a bad. Is that where they give you a grommet and all that? Is that what it's for?
I'm too old for a grommet.
Okay. So how would they treat? Is anyone able to at least pretend to be a doctor here? No. How do they treat glue ear then, Bridget? If you're not young.
The problem is why I panicked. I had non-Hodgkin's 14 years ago, and I had a lump come up. So I have a lump come up in my neck, and I totally panicked, and I couldn't get anywhere. It was hurting, and I thought, oh my God, it's back. But it isn't. It's glue ear. Yeah. I've got one ear totally blocked. They don't do syringing now at my surgery.
No, they don't. That's a big thing. That's a big thing.
So I can't hear a thing. It's terrible.
So you've got to pay £80 to get syringed, I understand. Is that right?
I need both ears syringed, but then I've still got glue ear.
I don't know if glue ear works with the syringe. Listen, I wish I could. We need Sarah Jarvis here.
I just how difficult it is to get any help at the moment sometimes.
Well, I think that this is one where poor old Bridget is going to have to Google. You're going to have to Google glue ear, but I mean, then we get into people trying to do their own treatment. Thanks, Bridget.
It's really dangerous. People self-diagnosing and finding different cures and remedies is a really dangerous thing. But this is the scenario for so many people right now.
This is what one of their policies is aimed at, is her being able to go for tests without seeing a consultant. So the GP says, I can't do ears, but I know a place that can, and you can get in today. Imagine that.
If that works, if it works as intended, then brilliant. It's a step in the right direction. But I just feel like these are all little sticking plasters over a much wider.
They're going to be overwhelmed
issue.
as well. They said
Exactly.
another initiative is they're going to offer 5 hospitals, and they can choose out of the 5 hospitals. Now, if I'm a patient, I'm going to try and go to the best one with the best facility. So you're going to have all these people
You're gonna
wanting to
have a
go to like
hierarchy of
one.
hospitals.
Yeah, and also, which is the best hospital? You know, what is it going to be? Google reviews or something? I mean, how do we choose? You know, the hospital that was the best last year may have lost its key surgeon to hospital number 2. Shelley, we lost you before, or you were busy, I gather.
No, I hope I'm back, am I?
Oh yeah, no, you're back. I said, "Here's Shelley," and there was silence, and I worried something had happened.
No, I'd just like to say we've been going on long enough about staff. Where they're going to get all these extra staff from? Because they say they're so short-staffed. Where they're going to put all this staff? I mean, Wes Streeting said before they'd had 14 years. All the time he was 3 years in the post. We've got a plan. We've got a plan. Well, he hasn't got a plan because he's put it out for a consultation for 3 years.
Social care thing, yeah.
Yeah, up here in the northeast, you can go and get scans at the weekend. We've had that already. So these are just little tidbits he's putting in, and this is no plan. Where's the dentists? I mean, hammering the GPs.
The dentist thing is, I know. The dentist thing is a whole, it's a nightmare, and they said they're going to get everyone a dentist, and I don't know if anyone can do that. I don't know if they can do it.
People are leaving the industry as well. Nurses, doctors, they're
well,
going
the dentists don't get paid enough by the NHS, so they all go private. That's what's happened. Shelley, thank you. Anne in Bournemouth, what do you think? Are these the 6 policies going to sort it?
I don't know. I don't think so. However, I run a loneliness charity.
Yeah.
I run a loneliness charity, and I get people out of the house, and I keep hounding them until they come. And 74% say that they don't visit the doctor as much, and their mental health and physical health and social mobility is a lot better. So I think the answer is in people healing themselves. And I think we're in a new world post-lockdown, and we should have new solutions for new problems.
Or so you mean that we should be directed to mental health a lot more?
I think we should be doing some work ourselves. We've all got the ability, and we just need to invest in ourselves.
Yes.
That's a good point. Yeah, James,
Strongly agree.
sensible, isn't it?
Yeah. On paper, yeah, it makes perfect sense. But the reality for a lot of people is that they can't afford to take
Healthy
this time.
diet helps. A bit of exercise, walking is free.
I know, but healthy diets cost money.
No.
I don't know, it's a piece of celery. I mean,
I know.
No, I'm not joking. I mean, veg is quite cheap. It's just that preparing it is a cost in terms of time. That's often what happens. And people have very busy lives and they go ready meals and so on. Thanks, Anne.